Yeah.
Hello. I can
Sir,
hear.
Good
yeah, you
afternoon.
can hear us, sir. Sir, good afternoon, sir.
Good afternoon,
Good
sir.
afternoon,
Good
sir.
afternoon,
Good
sir.
afternoon.
Good
How are you all?
afternoon.
How are
Dr.
you?
Good afternoon, sir.
Dr. Chakraborty, welcome to Eco-club Tagore International, and it's our privilege to have you with us today, sir.
Thank you. Thank you.
Yes, sir.
I
Okay,
am
so we are waiting for your inputs and enlightenment that we are going to get from you.
I am also very eager to meet students. Actually, I know they are in look confined to home now because of
Right.
lockdown and
Yeah,
COVID. So, lot of apprehensions are going among them and among
exactly.
parents also.
Yes.
Regarding so we are just at the mid to end phase of the second wave of COVID, and we all are hearing that third phase is about to come. Third phase is about to come. We all.
Good afternoon to one and all. My name is Debshata Choudhury, and I welcome you all to today's webinar on health and hygiene. As we all know, families across the country are adapting to the evolving changes in daily life caused by the COVID-19 pandemic. Today, we are fortunate enough to have among us Dr.Debjit Chakraborty as a speaker for helping children cope with changes resulting from COVID-19. Now I request Avnish Bhatnagar to introduce our speaker formally.
Dr. Debjit Chakraborty is a scientist, epidemiologist at ICMR, National Institute of Cholera and Enteric Disease. His major area of work is in epidemiology and public health. His other areas of interest include environmental health, occupational health, and vector-borne disease.
Rules and regulations. You all are requested to keep your mics on mute. Active participation will be appreciated. Be candid and speak your mind. During the question answer session, audience can write their questions in a chat box that would be addressed by the speaker. Now, without any further delays, we will request Dr. Debjit Chakraborty to start. Dr. Debjit Chakraborty, the stage is all yours.
Thank you all. Thank you for so sweet introduction of me. The best introduction of myself I ever heard so far. Okay. So I know all of you are confined for last 1.5 years due to COVID, and we are witnessing such a pandemic of a century. Last time such a devastating pandemic occurs in 18th century, in Spanish flu happened, and most of the countries of the world were affected, and we are now witnessing similar things in COVID-19, where most of the countries are affected. So now we are running among the second wave. First wave we have witnessed last year, and many people are affected. Many people had died, and the main problem with this COVID pandemic is it's very high infectivity, and because when some people are getting infected, they are transmitting it very quickly, and all the family members get infected. And what happened particularly in urban slum rural areas, they are quite have distance between the houses, but in urban, particularly in slum areas and flat areas, so there are close mixing, the population density is very high, so transmission gets very quicker. So that is the thing. That's why government of India has initiated this lockdown policy, so that our health system gets enough time to get structured and get a system ready to cope with the situation, because more number of cases are coming. So what happened initially, if we know, whoever is coming from abroad with a disease, with the symptoms of cough, cold, sore throat, fever, whatever it be, and getting tested and detected COVID-19, they are being put into hospitalization. So they are being isolated, and their family members are also put in quarantine, and they have been observed for any symptom. They have been tested. If they are positive, they have been again hospitalized, and the whole treatment is going on until they are again diagnosed as COVID negative within 24 hours. Two tests negative within 24 hours. But what it causes? It causes serious problem, because one person is occupying a bed for 20-24 days. So our health system, public health system, is not so much equipped to handle such a pressure of COVID cases if one person occupies a bed for 1 month almost. So then the policy of the ministry has changed. So what they decided, that if within after 10 days of infection, if he is asymptomatic for last 3 days, we can discharge and we can give home care. And gradually what we turned, that for milder cases we will give home care. We will not admit, we will not unnecessarily occupy the bed. We will give a home care, home isolation, and we will keep under monitoring. If the patient develop respiratory distress, breathlessness, shortness of breath, or any other symptom which is worsening, blood pressure is increasing or blood sugar levels falling, then we'll give a hospital care to that person. So now we are just ending the second wave. Now the cases started to decline, because I know even in last 1 month before, it was very high cases. In Delhi, cases around 4 lakh cases per day is increasing in India, and it is going very high. I know in Delhi also it is a huge cases has increased, and there is shortage of beds, shortage of oxygen. And what happened in this second wave, we have witnessed that more people are requiring oxygen. In first wave, only comorbid conditions and people with aged 60 years, 50 years, they were said that they are more vulnerable, and they get need to hospitalize for oxygen therapy, steroid, etc. But in the second wave, we have experienced that younger younger adults, maybe little bit more than 20 years, 30 years, they had fallen, succumbed to COVID-19 infection. They have witnessed rapid shortage of oxygen saturation. They need to hospitalize, they need to go in oxygen. So that was the cause. But the good thing is now the vaccination has came up. Vaccination has started in India from 16th of January, and I know only to till date India is a huge country with a huge population of 133 crore. Only 4 to 5% has been covered with 2 doses of vaccination till date. So many people need to get vaccination, but vaccination is still given for 18 years onwards, so not for children, because the vaccine need to be tested in children. That testing through clinical trial has started in different parts of India now among children. So when we found that those are safe and those are effective in children also, they will be given to children, but that will take some time. So that's why we are expecting a third wave around October to November, like that. Maybe in phased manner in different parts of India. Who are ending the second wave earlier may witness third wave also relatively earlier. So there we are thinking the third wave may affect children more, but because children are the only group which remain unvaccinated that time. If all the seniors have been vaccinated, all the adults have been vaccinated, children will be left unvaccinated that time. But there are certain positive thing in that also, because if children are only remain unvaccinated, children may not get it from an adult because they are already get vaccinated. If a unvaccinated person is surrounded by a chain or ring of vaccinated people, then the infection may not reach to that unvaccinated person. The chain of infection will be broken.
Yeah.
So that was our target, to break the chain of infection, so that even if children are unvaccinated, they will not get the infection from adult. Now what have happened? So far, whatever the children has been infected, I can tell you that overall out of total infection up to 19 years age, that is children and adolescent, they comprise 12% of all COVID-19 infection till date. So how these 12% cases occurred? Actually, they have got the infection from their parent or their family member. Actually, adult bring the infection from outside actually. So because the infection spread from one person to another person by sneezing, coughing, speaking, talking, the from the breath, from the discharge of nasal and mouth, it goes to the virus spreads to air and it goes to another person to droplet. So maximum cases we have witnessed that the family members, adult family members, are infected earlier, and they transmit the virus during very early stage of infection when they are not actually aware they have COVID-19. Actually, what happened to me also when I have got COVID-19 initially is I have mild sore throat, mild fever. So that day I am not aware that I have COVID-19. So I am mixing with my son, with my wife in similar manner without any restriction. So during that time, the virus spreads from myself to my son. So the same way other children got affected. So now if adult cases we can restrict, so probably their children may remain unaffected because they will not get the virus from adult person. That is a positive thing. Even they remain unvaccinated. And another positive thing on even in second wave we have witnessed, though children 12% of all cases are children, but out of them only 1 to 2% require hospitalization because children have less immunity. So that's why their immune modulation or this immune storm which is affecting actually, which is the reason for the early death due to COVID, because of cytokine response or immune system get hyperactive, and that's why all the immune modulators, all the chemicals are being released to blood, and that is creating the worsening of the symptoms. So since children have less immune modulation, their symptoms are still milder. So we have found 90 to 95 to 96% cases of children, they are milder. Only 1 to 2% cases of children require hospitalization, and within that maybe 1 to 2% further was not surviving to the infection. So the rate of hospitalization is very low. But we don't know, in third wave there may be mutant strain may appear. So in case of a mutant strain there may be more serious symptom in children, but we are expecting that will not be very high, that will be very less. But even we are anticipating, we are preparing, we have to prepare for the worst situation. That's why hospitals are increasing their COVID beds for children, COVID ICUs for children, ventilators for children. But that we should not panic. That is the way we are preparing, so that we can combat any emergency, any urgency, even 2 to 3 days of oxygenation, 2 to 3 days of critical care support observation if required. We should provide that to every children. That is our goal. That is our idea. That is our logic behind the rationale behind the plan. But the what we need to do, we need to prevent. That is our main goal here. We have to prevent. First, the first main step of prevention is vaccination, but that is not available for children right now. So I request all the adults, all the parents, all the family members should get them vaccinated. There should be no hesitation of taking vaccination. There may be some adverse effect of vaccination, pain, fevers, site of injection, maybe solvent, but those are milder side effect. Anaphylaxis is very rare. It's happened in all vaccination. Similarly, in we cannot say in medical science anything will not happen at all, but it will happen in very very minuscule amount. So my request to all the uh, parents and family members to get them vaccinated as and when they got the scope, because with 2 doses of vaccination chances of protection was more. So even even during pandemic, a vaccine is 60 to 70% effective. That is huge enough, because there is a notion that people are saying the vaccine is only 60% effective or 70% effective. Why should we get vaccinated? But that is not the case. We have to understand that this is a pandemic, and we have developed the vaccine within 1 year. Because in 2020 we have first cases in COVID in Kerala in 30th of January, and within 1 year, 16 January 2021, we have a vaccine for use. So in such a short time we have prepared the vaccine. So that is, even if 60% to 70% efficacy it has, so that is very good, because it is a during pandemic, even a vaccine has a 50% efficacy, WHO considers it, World Health Organization considers for implementation. So we should not have any hesitation or have any inhibition about whether us vaccinated or not. If the adult members are vaccinated, then our children are very much protected, because chain of transmission will be broken. They will not get the infection from their family members or adult members. And for children, I know this lockdown is going on. Schools are going online classes, so yeah, we have to be restricted to our home. But even if we maintain our hygiene, if we wash our hand frequently, we maintain the distance, 6 feet distance or 2 meter distance among others while talking. We visit outside in restricted way. We wear mask. Mask will be used for 6 years above, not recommended below 6 years. So mask also we have to use properly, not side by side, not it should not it should cover the whole nose, mouth and the chest. So proper wearing of mask when we are going outside, restricting our visit to outside, more use our IT system, internet, our telephone, WhatsApp for speaking. And most of the thing we have to keep our morale high, keep our spirit high. We should not be depressed, we should not be very sunken that, oh, we are not going outside for 1.5 years, so it's very disappointing, demoralizing. But you have got an opportunity of 2 years to learn many things at home. You can read lot of books, you can create very many things, you can draw, you can develop many handicraft, you can, there are now, it's a, you are blessed that it's the IT sector is there, so a lot of courses are there in online. I am also doing many courses in online, attending webinars. So it's funny thing doing online course. So don't get yourself under boredom. Once you get yourself under boredom, then nobody can help you. So get yourself out of boredom. You talk with yourself. Do WhatsApp call, video call. So it's a nice thing. We have a lot of Zoom, WhatsApp, Google, anything, Google Meet. Any we can, you can talk with our friend. We can see our friend. In our times those are not there. So even I know when my father is in office, I don't know when he will come. I cannot talk unless he comes back at night, and when he will come I know that he has come. But now my son is calling through WhatsApp, 5 years old son is calling through WhatsApp call, dad, I will do a WhatsApp video call with you. Okay, so those amenities are with us, we should utilize this. So it is a blessing that before COVID our IT system has come. So we have good connectivity, good socialization with all parts. So now I am in Kolkata, you are in Delhi, we can talk to each other. So it's an amazing thing. It has happened. It's a, I mean, blessing of the technology. So we have to keep our morale high. We have to listen to news, but we have to filter the news. We should not listen to all the news, because there's a lot of fake news, lot of information going on, and always we know media will scare people, because if media says this day this number of death happens, next day this number of death happens, anybody will be anxious, anybody will be very traumatized, fear. But you should know that many deaths are happening in India for other than COVID also. No media is showing them regularly, no media is showing the cancer death or tuberculosis death every day. So if you are aware of those deaths regularly, and many people will panic. For children there are a lot of severe disease, meningitis, encephalitis, a lot of things are happening, but we are not have access to those information. That's why we feel happy, we know the world is very beautiful around us. But when we go to hospital every day, we come to our lab every day, we have the data, we know this thing happening, many sufferings are happening, but still we know life is beautiful, world is very good, a lot of amenities are there, we have to enjoy, and it's the nature has provided us, we have to give back to the nature, then only the equilibrium of nature will remain. So I will suggest, don't be disappointed, don't get boredom, but use this opportunity that you have an opportunity to experience a pandemic, experience a face a pandemic, so you can tell this to your future generation that how you have passed the pandemic, how you have, what are the days you have seen, what are the days of fighting. You have all read in the history book about independence of India. There are a lot of struggle, lot of sacrifices have gone. So time comes when time takes a test of humanity, and humanity has to pass. Ultimately, always humanity wins, because they are the best creation of the nature so far. We know from the biology or life science, the survival of fittest happens, as Charles Darwin said. So I will request you to enjoy even the crisis, because even if you enjoy the crisis, then only you can fight. It's an altered situation, but there are many good things in altered situation also. So you read news, you don't be panic, you filter the news, you discuss with other people, prepare for, if you get any illness, you prepare beforehand how you will combat that illness. You discuss with your family doctor, if I have these symptoms, what I will do. Try to use home remedies. Okay, so don't panic, and be very happy, be very together, be very cohesive, help other, Tell your family members not to segregate others because of COVID, just to empathize them, give them all the support, because it's today or tomorrow. Today somebody else have the infection, tomorrow I will get the infection. So do not segregate, do not just fight the crisis, not only medically but also humanitarianly, being responsible, being supportive, and being friendly, because we are one family of human being as a whole. Okay, so if you have any questions to me, if you want to know anything, if you're feeling anything, just, if you're not even question, if you want to say anything, just speak out. What is happening in your mind? What is haunting you, people? And how you are worried, or what is your thinking process is going on at this moment? Just tell me. Just share your ideas.
Shani, do we have a few of them?
Yes, ma'am. We will take
Yeah.
some questions from the audience.
Yes.
So, Sayam, can you please ask your question?
So you have mentioned that we should get vaccinated and the vaccination drive is speeding up. So what are the long-term effects of the COVID-19 vaccine?
COVID-19 vaccine has short-term effect, because those who have injected, they may have fever or pain in the site of infection, maybe some headache. Those will not last very long. That they will last only 2 to 3 days maximum. Actually, they will go. But in some cases, they may experience some rash, some allergic rash. That may last little bit long, but those symptoms are very rare. That may happen maybe in 2% in 1 lakh people, like that. So those may take some medication, some anti-allergic injections, that may take. But if one people have such reaction during one injection, they should not take the second dose. Actually, people those who have allergies to other vaccine or other medication, they get the such type of allergic reaction. Otherwise, to 99% people will get very mild symptom, mild fever, mild pain in the site of injection, that will last only 2 to 3 days, not more than that. So
So if children get vaccinated, will the effect last till they grow up?
children will now not get vaccinated, because vaccine is not tested among children. The testing is started. If in future the vaccine is open for children, then only children get vaccinated. And like all other vaccine you have taken in your childhood so far, it will be similar like that. A small prick and some pain or some fever may last for 1 or 2 days. Then you will not understand anything, but it will give you protection. 2 doses will give you protection. But at present, vaccination is not open for children. It is
I,
being
uh,
trial.
yeah, I think, sir, he is trying to ask, like, if we take the vaccine, will it protect us lifelong?
No,
Uh,
that is not documented yet, because for flu vaccine, if I forget COVID, if I consider about flu vaccine, we know for flu vaccine every year we need to take flu vaccine. We need to take every year one flu vaccine, because flu vaccine serotype, influenza serotype change, virus serotype changes during every year or every season. So new serotypes comes. So any vaccine cannot give protection for lifelong for flu. But there are some disease like Japanese encephalitis or measles, which can give lifelong vaccine protection, but not for flu or not for COVID. COVID, we are now thinking that 2 doses of vaccine at least give 1 year protection, but it is very early to say how long the protection has been sustained, because those studies are yet not finished, because the time has not come, because we are now trying to just see the immune response among these vaccinated individuals over a 6 month, over a year. Then only we can come with some definite data that whether this COVID-19 gives how long protection, but not lifelong, not lifelong.
okay.
Lavanya, you may
Thank you,
ask
sir.
your
So may I
question.
ask a question?
Yes. Good evening, doctor. My name is Lavanya. The coronavirus is mutating rapidly, and we hear of new variants almost every month. So, will this mutation ever stop or slow down?
So Lavanya, just I can tell you not only for coronavirus, any virus in the world, any bacteria in the world undergoes continuous mutation, because mutation is like a change, like a adaptation, like what we do, we adapt to different situation. Human being also change, like that human genes also mutate. We cannot see because we did not test. But so similarly, virus, bacteria all mutate, all adapt to the situation. So it will be difficult. I know that when a virus mutates, this will be difficult. But what I can say, that even this mutation, I know the question is about treatment is not a question, because treatment is similar. The question comes about vaccination, whether the vaccination has been given under one serotype or one genetic pattern, whether even after mutation the vaccine will remain effective or not. That is the main concern. But if the mutation happens in few cases, few segments of the gene or few amino acids, then some protection the vaccine will exert, because the vaccine will generate antibodies against the other segment at least. So there will get some protection, it will not be zero. So but mutation is a problem for many disease. Even if for antibiotic, we know now bugs are given antibiotic resistant. So mutation is a problem, I understand. But accordingly, science is also evolving, scientists are also working. So they will come out with solution how to combat with mutation. Like that influenza virus gets rapidly mutation in every season, every year. So those who take influenza vaccine, they have to take every year the vaccine. That is the thing. But the main thing in COVID is the death here. If the severity of COVID reduces to the vaccination, that is enough, I think. Because if COVID remains a disease like fever and sore throat or mild cough, like we happen in other viruses, respiratory viruses, day to day flu viruses, common cold, common cough, then it will not create that much panic, that much pandemic. It is the mortality and the severity, that is the problem. So even if vaccination provides a reduces severity against a mutant strain, then our purpose is served. Okay.
Okay,
Shivani,
thank
you
you,
can
sir.
ask your
I
question
think
now.
May I ask
Shivain,
a question?
one second, beta. All of you will get a chance. Shivain has raised her hand for a long time. Shivain, you can ask.
Sir, I want to ask a question that when will the like not a permanent vaccine, a vaccine which can protect us from coronavirus from 3 to 4 years or 4 to 5 years, like that kind of vaccine.
So it is very early stage, because 4 to 5 years have not passed since the vaccine has come. So now we are thinking at least 1 year protection, because to document it for 4 to 5 years, we need to follow individual after vaccination to follow 4 to 5 years the antibody level, how it's happening. So that is not possible now, because 4 to 5 years is not passed now. So at present we are thinking of at least the response sustained 1 year. If that is there, so in 1 year, if the cases is diminished, then this pandemic will go. But if the mutants coming, cases are coming again and again after and after, even after vaccination, the cases start to continue, then there's a problem. So now we are thinking of resolving the pandemic, because we don't know, later on it may happen that COVID may remain as a virus in the nature as an endemic disease like all other virus. In such cases, then there is a scope of following up 5 years, 6 years, or 10 years how the vaccine will work. And if the vaccine, what I have told earlier also, if the vaccine reduces your severity, if it reduces the necessity of hospitalization, then I think our purpose is served, because it will come like a common cold and it will pass. All of us don't take flu vaccine. Some of us take, who are more prone to cough and cold, and in the winter we catch cold. Those who take flu vaccine every year. But in our younger days, in our childhood days, there was no flu vaccine. We have bouts of cough and cold. We survived because nobody will die of those. May have viral pneumonia. It goes on our own. But that is the thing. So now it is a very early to say of what happened after 5 or 6 years. But now the focus is to resolving the pandemic, to prepare a vaccine which gives not only protection but also reduce the severity. So if severe cases comes down, if hospitalization rate declines, then we can fight out this pandemic, and then gradually we can see how much the protection lasts. And now we are trying to measure the antibody level and try to see the protection, but even we are not sure the antibody level is a correct measure of protection or not. We all know that we have memory cells, because now if I measure my blood, I have taken vaccine in last March, so my and there's very less amount of antibody in my blood or serum. But we don't know if your memory cells captures the epitope, then when a subsequently infection comes, a virus again affects my tissue, then our memory cells may produce the antibody, which is not right now in absence of the virus. So that may be the more authentic way of validating how our protection will last, or how long our protection will last. So right now we are not in a position to say that. We need more time to go, and then following vaccination and more number of vaccination, then only we can tell. And also I can tell you, all of us are taking vaccines, but there will be some vaccine non-responders also. No vaccine will effective in 100% of individual. So there will be some non-responders also who will not respond to the vaccine for immunizations. So that will be there, but most of the cases I think vaccine will protect. Okay.
Thank you, sir. Ivania, you may ask your question now.
Yes, sir, I would like to ask, how long are we immune from COVID-19 after getting infected?
How long? Pardon, I didn't hear you. How long?
Sir, how long are we immune from COVID-19 after getting infected?
How long you will be in room? Like suppose today you have got COVID-19 infect. Today you have symptom. You need to, if your symptom is mild, you have to stay in home for minimum of 10 days. Meaning after 10 days, if your symptom is not there for last 3 days, you can break the isolation. But if you are hospitalized, after coming to hospitalize 7 days more, that is 17 days. So after 17 days, you can go out of home actually, because that is for, so that you should not transmit the virus to others. But if you are feeling well, you can go. But generally people have mild to moderate symptom, may have weakness, residual weakness, so better take rest for 10 days and 7 more days actually.
Sir,
Then even after 17 days you will have symptoms, but gradually according to your symptoms you need to adopt and you need to start your activity.
Sir, I'm trying to say that how long are we immune from COVID-19 after getting affected?
She is, I think, asking basically
long
that
you
after
will
we
be-
get infected with
how long you
COVID-19, yeah, how long are we safe, like without taking the vaccine?
actually they take told 3 to 6 months actually, but it varies. Everyone may not have same amount of antibody response after COVID-19. So earlier it has been told that after COVID-19 you need not take vaccine within 3 months, but now that taking maybe 6 months, you can wait for vaccination. Without vaccination, after 6 months you can take vaccination if you have COVID-19. Don't take early, because longer, if you give a delay, then it will be help you full to you, because then this vaccine, this antibody you acquire from your infection will go off, then the vaccine will come, it will give a boosting dose, so that antibody titer will increase, then more gap you will give. Okay.
Thank you, sir. Bubbly, you may ask your question now.
Yes, sir. So my question is related to the nasal drops that are acting as the vaccine. So how effective are they? And after we take them, do we have to take the actual vaccine like COVID Shield?
Nasal drops is not recommended now in India. It has not launched in India. Now only two, Covishield and Covaxin have launched. Sputnik is on the way, but still I will suggest nasal drop if gets cleared to the Director General of Clinical Trial, DCGI, then you can obviously take. But until and unless it is recommended by the Government of India, it's better to take Covishield or Covaxin, because those two are tested and tried vaccine. Sputnik
All
will
right.
also include it.
So, sir, is is there a comparison? Like, is the actual vaccine more effective than the nasal drops, or they have the same?
Not like that. That is a nasal drop is a route of entry. Okay, even nasal drop may produce your immune response because the main infection when you get it comes to the nasal route, nasopharyngeal route, nasopharyngeal swab and throat swab we take. Okay, so the virus colonizes in the nose. Okay, so what happened nose and pharynx, this nasopharyngeal tract where virus colonizes. So wherever your body the virus is there, your blood will produce the antibody, so that will not affect the response. Root will not affect the response. Okay, if that is accredited by government of India, so you can use it.
All right, sir. Thank you, sir.
Kavish, please ask your question.
Sir, like 3 months before I got COVID-19, so sir, till how many months I will be safe from the COVID-19 virus?
I think sir just answered your question.
3 months
Okay,
to 6 months.
around 6 months.
Hmm.
Okay,
but
Tavish.
but, that is not uniform to many people. I have
Yeah.
seen a person who have developed December COVID in December. Again in March, she have developed COVID second phase. So that we cannot say very uniformly. Nothing is very hard and very strict in medicine. So it's average 3 to 6 months generally. Even the second episode happy it will be mild.
Thank you, sir. Malsama, you may ask your question.
Sir, I had a question. In the first and the second wave of COVID-19, we saw a lot of misinformation spreading about
Malswama,
symptoms. Yeah,
Malswama, just wait on, hold on. Sir has lost connection.
okay, ma'am.
Yeah.
Sorry, connection lost due to another phone.
Yeah. So we understood. No problem. Yes, Malswama, you may ask.
Sir, I had a question. In the first and the second wave of COVID-19, we saw a lot of misinformation or fake news spreading about things like symptoms, miracle cures, and even saw people denying that the virus exists. How do we stay safe from such false information?
Actually, there are a lot of information spreading around because when an epidemic happens, there is also happen infodemic, the epidemic of information. So a lot of information comes around because we have to understand one thing, that everybody do not know about this infection. This is very new thing to us. To the whole scientist community, it's a very new thing. It's an evolving thing. It's a dynamic thing. Okay, so I would suggest better to rely on the government websites, ICMR website, Indian Council of Medical Research website, where I am working, the website of Ministry of Health and Family Welfare, MOHFW website. They are publishing the proper guidelines, which are tested and which are discussed for national. There is a national task force. ICMR has created a national task force on COVID-19, including the leading epidemiologist and leading virologist from India. They are sitting and they are reviewing the data, they are reviewing the literature, and they are giving a meeting. Even after that, they are recommending a policy. So better what ministry is giving and what WHO is giving or what ICMR is giving, better to rely upon that. And even if your state government produce some guideline, those will basically based on ICMR guideline. So better rely on that also. Don't rely very much on private organizations talk or any local doctors talk like that, because they have half-hearted information, but they can say something which is not entirely wrong. Okay, but you mostly rely on the government published recommendation. But even when I can say those are also dynamic. People may say today government is saying gap between two doses 3 months, tomorrow it's saying it's 6 months. So what to rely? So what government is saying, that time you rely on that, because if government is saying something today, that may not be fixed for next 2 months or 3 months, because whenever new data is coming, new research is coming, new evidence is coming, government also updating their guidelines, okay, in the light of new available evidences. So better to rely on the government information from government website.
Thank you,
Okay.
sir.
Sir, can I ask?
Please ask the question.
Yes, yes. Tell me.
So, a few months ago, plasma therapy used to be a effective treatment procedure for COVID. So, sir, why is it getting discontinued nowadays?
No, the treatment is going on. Okay, we have to understand there is no specific antiviral drug for COVID. Whatever we are giving, that is after different clinical trial, different known drug we have repurposed for COVID. We have drugs for other diseases which may have some antiviral properties for against SARS-CoV-2 that we are giving against COVID. Okay, but initially, suppose I can tell you when initial days COVID has come, it is said that hydroxychloroquine and azithromycin is a very good combination and effective against COVID. And many literature have produced through clinical trial that is hydroxychloroquine is effective. But later, some months later, around June or July, when I read new literature, they said no, COVID hydroxychloroquine does not exert extra benefit over non-hydroxychloroquine group, and there are more adverse effects with hydroxychloroquine. So they changed the regimen. Now doxycycline and azithromycin and ivermectin have more antiviral property, so now they are giving. Now favipiravir has come. Favipiravir has a good antiviral property. It's an antiviral drug that is being administered for mild to moderate COVID, less than 5 days of infection. That is effective. So whenever anything is evolving, some evidence is coming and which is found better than other, that is being recommended for practice. But nobody is very much pinpoint against COVID. All are effective in some other viruses, and in some group it is found effective. That's why it has been given. It's not about antibiotic that you do a culture, you find that sensitivity antibiogram, and this from the culture antibiogram report you suggest no, this drug is 100% effective than this organism. So it is not like that here. We initially in different animal model and different relevant virus, if the drug is some antiviral property, they are giving it to induce viral suppression, and rest of the thing is symptomatic. If you have fever, you will take paracetamol. If you have nasal discharge, you will take say levocetirizine, like that. For children, they are not telling antibiotic to use more mild to moderate cases. If they have secondary infection or it's severe, they're telling some antibiotic or steroid for that purpose. So I can tell you whatever treatment is going, treatment is supportive, treatment is empirical. Mostly with supportive therapy, COVID gets cured. But unless there is severe lung damage when some ventilation or BiPAP or oxygenation is needed, then there is a problem. Then you need suppose those facilities or those intensive care support to help the system. Mainly what we have seen, mainly what is the main problem of COVID? COVID's problem is due to not the virus itself. It is the antibody response against the virus, the immune response. That's why we give steroid. Steroid suppresses immune response. So the cytokine storm, we read in the newspaper, it has a cytokine storm. It's a hyperimmune activation. So those things actually lead to the fatal outcome in COVID. So that is nothing to do with your antiviral. There we need to suppress our own immune system, because our own immune system is producing excess chemicals which is producing the exaggerated symptom and this collapse in our lung and our body. So multi-systems, liver, blood vessel, heart and kidneys. So there we need drugs like steroid who suppresses our immune system, and some drugs like enoxaparin which leads our thrombus, because we have coagulation. There is thrombus created in our blood vessels which lead to clot in our heart and blood vessels and brain, that lead to pulmonary embolism. For to break the thrombus, we need some drug like enoxaparin, euxaparin, which is a antithrombin inhibitor. So those are the things which is nothing to do with virus, which is more supportive, and those are life saving in case of COVID-19 deaths.
Sir, I have one more.
Sohini Bera, please ask your question.
Yes, sir. So, sir, I wanted to ask that what has caused this pandemic, to affect the whole world? I mean, I know that it came from Wuhan, from that lab, but what, um, what, thi- what, it came from which animal or which thing. I mean, I'm just reading that it came from bats and snakes, but I don't think that they're actually true. So I just wanted to ask you that what is the major, I mean, what is the root of this virus?
Actually, coronavirus is not a new thing. Coronavirus existed earlier in the human, bats or canine, snakes, those are pigs, other animals. In the other animals, coronavirus was earlier there. We have read about coronavirus in our MBBS course, medical courses. The coronavirus was a very weak virus, very weak zoonotic virus. It was there. Like many other, like Ebola is a much stronger virus. But coronavirus was very weaker virus, like Hunter virus, coronavirus. Those are there, but those are animal virus, known to cause animal disease, not human disease. But now this COVID-19 SARS-CoV-2 strain, that is something, it's a mutated animal virus, and resortment happens within the animal and human, so that it becomes lethal to animal, a human, and and it has transmitted from human to human also, because earlier when a virus transmits from animal to animal, so it doesn't create epidemic among humans, and animal to human transmission is very low, like your bird flu, avian flu, swine flu, H1N1. Those viruses are also animal virus. In swine flu, resortment happened within the pig. In avian flu, genetic resortment happened within bird, poultry. So those viruses also transmissible to animal to human, but that is an earlier phase. But as we know, bird flu doesn't go from human to human till date, but swine flu goes from human to human, and this COVID also goes from human to human. So when a zoonotic virus transmits from human to human, it carries a higher potential for causing epidemic. And when this epidemic happens nationwide, many nations involved in the same epidemic in the same time, then it's called pandemic. So that's why this mutated coronavirus has transmitted very rapidly, and there is a factor we called R naught, that is basic reproductive number. That means how many new case was created from one single case of one infection. For COVID, for coronavirus, it's around 2.6 to 2.7, like that. So one case is on an average giving rise to 2.6, 2.7 cases. So that's how it is multiplicating. It's rapidly multiplicating. If this is endemic, so it's one case will only give rise to one new case. Then it's endemic. It will stay in our system, stay in your community. But if one case give rise to more than one case, two case, 2.5 case, 3 case, that means it will spread rapidly. And when it spread rapidly, it causes the pandemic. Because today I am infected, my family member infected, I meet somebody else, they are infected. So this chain goes on. Whenever chain goes on, it infects many people. And at the same time, because it's a new virus, we do not have any immunity against this virus earlier. So we all are susceptible. So when a virus comes against which we do not have any immunity, the community or population get infected very easily. And that's why epidemic or pandemic happens. Whenever one community has sufficient amount of immunity, then epidemic doesn't happen. Because if we have immunity against TB, we have immunity against malaria, we have some level of immunity with dengue. That's why those doesn't cause epidemic in day-to-day basis. Whenever in a pocket or in a region, our immunity, population immunity comes down, then only epidemic happens. Like we have heard earlier, cholera epidemic. Cholera epidemic happened in many parts. Even today in Odisha, within India, in the Yemen, Haiti, the other countries, third world countries, Somalia, they have bouts of cholera epidemics because they do not have cholera earlier. Now people do not have immunity against cholera. So when cholera comes to them, many people at a time get infected. And if many people get infected, someone will always die, because all will not survive. So that creates pandemic. Pandemic or epidemic is the many cases in the same time, in the same place happen suddenly. That's when how pandemic evolves. Okay.
Okay, sir. Thank you, sir.
So we have a question in the chat box. Drishti Verma says that my father is diabetic. So if he takes the vaccine, what will be the consequence? Because it has caused casualties in your family earlier.
No, diabetic patient can take the vaccine. There is no restriction. If your father has any allergy to any vaccine or any drug, then you need to consult your doctor for taking vaccination. Only having diabetic is not a contraindication to vaccination. Okay.
Siddharth, will you
He
please
should
answer
take a
our
vaccination. If
question?
you're diabetic, he should take a vaccination because that gives him protection.
Good afternoon, sir. Sir, I had a question that since the pandemic has started, there has been a lot of discussion about steam inhalation.
Yes.
Some are saying that steam inhalation it helps in recovering faster. Some are saying that this is not true. And then there is a new research which is showing that when the COVID patients when they are taking steam, it is forming aerosols and spreading the virus. So is it true? What are your opinions on this,
No,
sir?
no, no. Steam inhalation will give you symptomatic relief. Okay. So even where you are having COVID, okay, from your secretion, others may get affected, but if you have to take the steam inhalation, you can take in a separate room. So nobody, even if you are COVID affected, you are sneezing, you are coughing, so virus is in the air around you. So if you take steam, it will affect the other people. That will not a very huge proposition, but stimulation will give you a symptomatic benefit. If you have a congestion throat in nose, your secretion is going there, you have a sore throat, stimulation it will help you. It will give you symptomatic relief. It will clean your airway. Some heat it goes to your lungs. If your not lungs, throat and the trachea, those secretions will be dry up. Okay, it will help in your taking this nasal congestion will there, it will be relieved. So stimulation will be helpful, and if you take in a separate room, it will not affect others, not in a way.
Okay, sir.
Sir, I had a question. Sir, while we engage in physical activity, there is a lot of sweat and dirt that accumulates, but also wearing a mask is a necessity. So, what practices can we adopt in order to avoid the fungal infections or any kind of infections that we might contract due to this?
I think best thing is to wash hand as frequent as possible in proper way. There are 8 steps of hand washing. If you Google, all of you can get it. So if you frequently wash your hand, even if there is no sanitizer, oil-based sanitizer, you just give a soap and wash your hand properly before eating, after using your washrooms. So that is the best thing. With washing your hand, you can just get rid of so many infections, not only COVID but also diarrhea and other infections also, respiratory infections also. And maintaining your cough hygiene, cough etiquette when spitting, coughing, sneezing, use a handkerchief, just a handkerchief, and you avoid so that it does not go to the others actually. So those are, if those hygiene measures you maintain, not only for COVID, your overall general health will also improve. So it will give protection for lot of infectious disease, and that is a healthy behavior and healthy etiquette as well. So I request all of you to maintain this healthy and hygienic
Hygiene.
habits.
Okay. I think Prakhar had a question for a long time. Yes, Prakhar, could you ask? It was related
Yes,
to his
ma'am.
mother or something. Yeah. Yeah.
Yes, ma'am. Sir, my mother is allergic to paracetamol. She has rashes like red spots on the body after taking it, and she has high blood pressure also. What is the alternative of paracetamol, and what precautions she should take before and after vaccination?
Paracetamol rarely causes allergy, but if somebody have allergy to paracetamol, he cannot take paracetamol. So then alternative is to give a sponging. You just a cold water sponging if you have a fever, cold water sponging in your head or forehead. Then due to the sponging, the temperature will evaporate using that water, using the lean heat of that water. You all know. So that way, just mild fever will goes off to this, and nothing more you need to do. If any pain or something is there, they can have brufen or something like an analgesic, mild analgesic, not very high. But paracetamol is allergic, might be allergic to other similar group of drug also, that you need to check with doctor. But cold sponging is very safe. You can use this cold sponging to avoid fever in case of vaccination.
Thank you, sir.
Shraddha, please ask your question.
Yes, sir. Sir, I had a question that like, are the cloth masks effective?
Yes,
Because
yes. Surgical mask is ideal, but surgical mask is not for everyone. But cloth mask is effective, very good cotton mask. I am also wearing some cotton mask, that is also very good. Okay, if you wear it properly, if you wear it half, or your nasal bridge is not properly covered, or it comes down the mouth, and the inner surface get contaminated by the if you hold it outer, then it will not effective. But if you wear it properly, it covered the faces, the nasal bridge and the mouth, then it is effective.
Thank you, sir.
Rishi, please ask your question.
Yes. So before the SARS-CoV-2 pandemic, a few countries were facing the SARS-CoV-1 epidemic that had only about 8,000 confirmed cases worldwide. So what's the difference in the genetic structure of both these coronaviruses, and why wasn't a vaccine required for the SARS virus?
Genetic structure, like in the amino acids, when you actually it's the RNA virus, we all know ribonucleic acids is the RNA. It's the RNA virus is there. So within the RNA, the some amino acids are different, that is causing the this mutation actually from SARS-CoV-1 to SARS-CoV-2. But vaccine is required because of severity. I told earlier, if it does like other flu virus, just we have a small cold, a small cough, a small sore throat, 1 or 2 episodes per year, then we don't think of a vaccine. It will automatically go off. But now, since it's a very severity happening, people are dying. Those who are even recovered, that long post-COVID complication is continuing because of those severity, and lot of people are getting infected at a time. Because we have seen for common cold, many people doesn't get infected. In season happens, few people get infected, and another season few more get infected, but not such a huge way. So that, and more or less healthcare worker, doctors are getting infected and dying. If doctors get infected and die, who will treat the patients? That is the problem. So that's why we need vaccination against SARS-CoV-2, because it should, even it doesn't give 100% protection against infection, even, but it reduces severity, it reduces mortality, then our purpose is served. We need a vaccination to fight against, stop the pandemic.
Okay, so if there was a vaccine for the SARS virus, since they're both coronaviruses, would it help reduce the symptoms of SARS-CoV-2 a little bit, if not completely?
Important is the segment for which the antibody has to generate it, that has to be there in that vaccine virus. What has been given you a DNA or a whole gene, whole virion in the vaccine, within the vaccine that component has to be there, like spike protein. Spike protein is the main component of your COVID virus, which is causing disease, SARS-CoV-2. So yes, if the antibody against spike protein is generated from that what is injected as a vaccine, then the antibody will affect that virus if that has spike protein. But if that part is mutated, then it may not affect. So that actually the scientists tried to put such a segment which is very common to all site of coronavirus. Then only whatever the type infects you, it gives protection against the any type of vaccination if the common part is inoculated to you. So antibody will be generated against a very common part like spike protein.
Okay, thank you.
Whatever the virus is given, that common part will be there for all the virus. So vaccine will generate antibody to neutralize that common part.
Yes, sir. Thank you.
Anyone else, Ashani?
I just want to tell
You
you,
have
my
read,
mom
all of
worked
you
on
have read lot
SARS.
of things, so that's why questions are coming.
Yeah.
All of you have
They're
read lot
reading,
of
they're reading a lot of things.
lot
Yeah, a
of
lot
things.
of
Google
news
is there.
around. Yes.
Our time Google was not there, so your time Google was there, so you can read lot of things.
Okay. So, Ashani, any more questions? Yes, ma'am.
Sir, I just want to tell you, my mom also worked on SARS.
Okay. Okay.
Now
Okay.
we will take one last question from Sahana, and then now
Okay.
we can close.
Okay.
Yes, so my question was, sir, that a lot of people, what they do is that they wear two cotton masks, like, sir, they call it a double mask. So, sir, is it actually effective? Because, firstly, like, I had tried it once, but it's very difficult to breathe in there. But also, what happens is that sometimes people just, they're wearing two masks, but, like, it just falls and a lot of their nose is not covered. They're actually not covering their nose, which is very important. So, sir, is really helpful.
Three layer cotton mask is helpful, but provided it has to cover your nose, the nasal bridge, and the side of the mouth and the mouth part. That has to be covered. But surgical mask is also helpful. They are much thinner. But three layer masks are helpful. Surgical mask or cotton mask, it has to be three layered. Okay. But if it's the children under 6 years, mask is not indicated. Even if 6 to 10 years, mask has to be use if it can occupy your whole cheek and chin the whole part. If something remains open, then that much effect will not be there. Okay. So you have to
Okay,
see
sir.
your nasal part,
Sir,
nasal bridge.
please can I also ask a question?
Thank you.
Who is it? Ridan, last question, please. Yes.
Okay. Sir, sir, so my mamu is a doctor. So sir, he says that Sputnik is like really effective for COVID-19 virus. Is that true?
Sputnik's trial is going on. I think government will give some recommendation because Sputnik is being tested now. So soon, in certain pockets, Sputnik I think has been implemented. So it will come very soon. I think some recommendation will come on Sputnik. It has not yet come, but it will come. I think so based on the data.
So like,
Trial
will it help with COVID?
It's a vaccine for COVID only, beta.
the vaccine for COVID only. Vaccine for COVID.
Okay, sir.
It's a COVID vaccine only.
Okay, sir.
Okay.
It's an
Thank
RNA
you.
vaccine. It's an RNA vaccine for COVID.
Anyone else has any question?
Yes, ma'am, I have a question.
Who is it?
Ma'am, I am Avnish.
Avnish, what more questions you have?
Ma'am, like some people have tested COVID positive even after getting the second jab of COVID-19. So is there a need for getting a third dose too?
No, that's why I'm telling the vaccine is 60 to 70% effective. That means somebody will 30% will also have COVID. It will not 100% effective. But even in pandemic, a 60 to 70% vaccine is helpful. But if it reduces severity, that is the target of this vaccination. And for third dose or booster dose, it has not been identified yet how much after the second dose a boostering is required, or how much more benefit or how much more boostering of immune response the third dose will be given. It is not tried right now. So when some policy will come on boostering, you will come to know whether a booster dose is required or not, and what is the interval of that booster dose also. But since say 60 to 70% vaccine is 60 to 70% effective, some cases will happen even after vaccination they will be infected with COVID, but severity will be very less among them because I heard that Devi Shetty to tell that in their ICU they have not found any patient who have received two doses of complete doses of vaccination. So generally they are saying if a patient takes two doses of vaccination and spend 15 days more, so chances of getting COVID is reduced, and even if they get COVID, chances of getting a severe COVID is further reduced. So main aim is to reduce the severity and mortality.
Severity.
Okay, sir.
Thank you so much, sir. Now, I, as Shani Singh, on the behalf of Tagore International School, Vasant Vihar, would like to extend a very hearty vote of thanks to our speaker today, Dr.Debjit Chakraborty. I must also mention our deep sense of appreciation to you, sir, for being with us today and also sharing some crucial information regarding COVID-19 and maintaining health and hygiene in the times of the pandemic. I would also like to thank our principal, Ms. Shifali Gupta, our senior headmistress, Ms. Shivani Gupta, teacher head of the Eco-club, Ms. Vandana Sen Gupta, and our teacher coordinators, Ms. Sushri Mukherjee and Mrs. Geeta Gosai. Lastly, I would also like to thank Sayam Sareen for creating the beautiful poster for the same webinar. And also thank you everybody for being such a patient, delightful audience. Thank you.